Know what's going on.
Me too.
Oh, see, we lost Tinwis. Thank you. So, welcome to the UBC Learning Circle. My name is Crystal Morris, and first of all, I want to recognize the traditional territory which our office resides here in downtown Vancouver, which is the Musqueam Traditional Territory. Today we are joined by the First Nations Health Authority for a presentation on the First Nations Health Authority Interim Health Plan and the proposed framework approach. The format for today's presentation are that the questions will be taken after the presentation, and on the Adobe Connect, we will try and capture all your questions, and I will relay the questions to the Health Authority team. And for us to gather the numbers, please expect an email for today's participation because it really is a large group today. So we have 20 video conference units across the province, in addition to about 50 on Adobe Connect. So there is quite the mixture of sites today from all over the province. And please keep your microphones off unless you're asking a question. And for today's question period, if somebody could actually just get my attention in the room, and I will just point to the room and say your name if that's possible. If we can just, because I know when we get to the question period, there's probably going to be a lot of questions. So today we are joined by Richard Jock, the VP of Policy, Planning and Strategic Services from the First Nations Health Authority. He is a member of the Mohawks of the Akwesasne and most recently held the post of Chief Executive Officer of the Assembly of First Nations. He has worked for the past 25 years for First Nations organizations and the federal government. As the VP of Policy Planning and Strategic Services, Richard provides leadership in the areas of health actions, federal and provincial partnership development, strategic community initiatives, business development, health policy, communications, community engagement, and quality assurance. So, and also in the room is Loy Wiley and a few is Isabel from the First Nations Health Authority. So I'm going to actually turn the floor over to Richard, and thank you for coming today, Richard. Welcome.
Well, thank you very much for your kind introduction, and I'm very pleased to be here this morning, and very pleased to see the level of engagement and participation in today's session. So welcome to all of those who are joining us, and I would say that one of our intentions also will be to circulate the PowerPoint that is being presented today, and as well for communities who are not as accessible in terms of broadband. We will also produce a DVD that can be sent around to communities for your further information. So if we can begin the presentation. And if we can go to slide 1, please. So one of the key elements going forward, and really an important way that we will assess all of our work, is that what we do should contribute to the overall vision of a healthy, self-determining, vibrant First Nations children, families, and communities. So really that's the key element, and if we boil everything we do down to our real clear direction forward, this will be our guiding principle. As Maureen Chapman has said, and I quote, "The purpose of the health plans and agreements and the new governance structure is to transform the health system to better meet the needs of BC First Nations." So really in going forward, really using planning as a key way to start taking those steps to achieve this vision is very clearly what this exercise is all about. Next slide, please. So this morning, what I would propose to do is to provide an overview of the proposed approach and the framework that's being put together for the first interim health plan. And this first interim health plan will have some pretty general aspects to it. It'll include the background and purpose. There will be a fair amount of the content which will be really about the interim steps being taken, such elements as budget, such elements as the first set of priorities coming from the regional tables, and we'll frame all of this in an overall document, which really will be the first of the interim health plans that will be developed and adopted
to enter text, press
for
key on the remote
the First
controlled
Nations
access
Health Authority.
on-screen keyboard. Press call
So,
on the remote control.
So if we could remind whoever to please mute your microphone.
Select contacts or speed down, press.
Sounds like a
this
voice
key
automated
here
message,
on the
but
remote
if you can
control.
please mute.
Select the site you want to call and press call on the remote control.
Okay, whoever's
funny, they
just
just
joined
didn't
the
call
room,
us.
Jennifer,
It
can you
would've
get
worked
them
if
to
they
mute
called
their
us.
microphone, please?
Would have been easy.
Yeah.
Okay, so we'll also speak a bit about the evaluation of the program and the subsequent reporting that will support the evaluation and the direction forward. We'll summarize our overall content in terms of a table of contents, and you'll get an idea of what the interim health plan will look like. I'll talk a little bit about the relationship between the interim health plan and the interest and opportunities for both communities and regional health and wellness planning to form a part of that plan. A little bit of discussion on engagement over the next period of time, and of course the timeline and next steps, which are quite short. But also I would say it's part of the reason why I think it's important to use engagement strategies such as this one to make sure that information is available in a timely way. And then of course we'll have some discussion and some questions and answers at the conclusion of the presentation. Next slide, please. So by way of background, the interim health plan is also part of the requirement for the release of funding under the agreements that have been reached within the province. The Canada Funding Agreement clearly specifies, and essentially there's a provision where there will be a holdback of resources until the interim health plan has been presented and approved. So this is part of the process and part of the steps which will occur in terms of releasing the funding over the next 6 months and 1 year time periods. The BC Tripartite Framework Agreement on First Nations Health Governance also provided for the preparation of an interim health plan, and as it states that these interim health plans will be prepared annually, and essentially then we would say that there would be a first interim health plan which would be prepared and submitted with a June 1st deadline. Essentially we would see this document as being a first step that part of what we would do is establish a framework for our interim health plans, and then we would have 2 subsequent health plans prepared in an interim basis, with a final multi-year health plan, which is required in the third fiscal year of the Canada Framework Agreement. So that's a bit down the road, and the interim health plan will provide the means by which we can further refine the interest going forward. And you'll see that there are some steps being taken so that we will have real detailed ways for this to happen over the next period of time. So just in general, the interim health plan and the multi-year health plan do need to be consistent with the Canada Funding Agreement, with the framework agreements and sub-agreements. But that's really a technical matter, and we don't really see many complications with that. Next slide, please. So again, looking at going beyond sort of the minimum requirements and going to look at what will be some of the key functions that will be provided through an interim health plan, is that this document and this planning process will serve as a strategic framework to guide the operation of the First Nations Health Authority and how it will work with its partners, such as the Health Council and the Health Directors Association going forward. It'll also help us to guide the transition process. And for those that don't know, on July 2nd, we will be taking over what were formerly called the Non-Insured Health Benefits Program. It'll be called the First Nations Health Benefit Program. So on July 2nd, that aspect will come over to the First Nations Health Authority. And on October 1st, all of the public servants and all of the budgets associated with the remainder of programs will then be transferred over to the First Nations Health Authority. So the strategic framework will be very important to guide that process and to really show what will be done, what are the interests, and how will we move forward. The other aspect of this is to look at how can this approach really reflect the overall strategic direction of the First Nations Health Authority, the Health Council, and the Health Directors Association. And each of those organizations will be undertaking strategic planning over the next couple of months. So the first interim health plan will really have a placeholder for these strategic plans, and subsequent interim health plans will actually have the details of those once those are concluded. The second part is having really reflected very clearly the different goals and priorities from each of the departments that have been created within the First Nations Health Authority. And of course, to respect the guiding principles and the strategic directions established for the First Nations Health Authority is to make sure that this interim health plan has a reflection of community and regional health priorities. So again, you will see a bit later that there is an overall process for regional health plans, health and wellness plans that is being concluded. And for the first interim health plan, we would reflect all of those community and regional plans that at the stage that they're at in terms of the submission date, and provide for immediately then us doing the work necessary to have really a thorough, vigorous process and documentation to include in our second interim health plan. Again, I would say it's really important that we meet the requirements of the tripartite agreement and funding agreement just to make sure that the funds flow and the process continues. So I think that's a real clear need. But beyond that, it'll really help to serve as a clear and validated communication tool so that as we go forward, it'll be readily understood what are we going to do over this next year. So that'll be a really important outcome that we anticipate for this interim health plan. It'll also serve really as a framework for us to report on an annual basis, and that again is important and is a key part of the accountability of the First Nations Health Authority to its communities and regions, but also to our partners, who are namely the province and the federal government. And lastly, as we develop these interim health plans and really develop our annual planning cycle, this will really serve as the basis for this multi-year health plan, which then will be a longer-term look that we will refresh on an annual basis. And as I said earlier, this interim health plan is due no later than the third year of the framework agreement. So we can go to next slide. So in terms of some of the content, and I'll go over this in a bit more detail and a bit later, but we'll look at startup plans, program plans and services, goals and priorities. There will be a first set of health performance standards, and I'll talk a bit more about how these will be developed further and to a higher level over the next period of time. And then, of course, how the resources will be allocated and the general budget that would be part of the first year of operation, and certainly anticipating where year two would start out. So next slide, please. So getting a bit into the overview of the framework. I'll go over this fairly quickly, but I think it's important to state that one of the things that I saw in my fairly recent arrival here is that there's really been a tremendous amount of work done over the last couple of years, and really the interim health plan will be a way of arranging a lot of this work and putting it into one document. And I have to say that I think when you look at such items as the 7 directives, operational guidelines and policies that have been developed, it's very clear to whoever reads it what are the set of interests going forward. So I think it's important to reflect that this interim health plan, although there's a short time frame to put it together, it actually reflects a whole stream of effort that's been underway for a number of years. So the first aspect will be an introduction and background, and really the purpose, describing the purpose of the interim health plan, and the subsequent multi-year health plans will be really set up in that section. But also then we'll do some linkages, description of the linkages with other related plans and planning processes, some of which are internal to the First Nations Health Authority, but some of which are external in terms of how FNHIB, that is First Nations Indian Health Branch, First Nations, and also the BC Ministry of Health and regional health authorities, how all of those planning documents will be related to our planning document. And I would say one of the things that is unique to the First Nations Health Authority, if you compare it to all other health authorities across the country, is that there's an emphasis on wellness. And I think that this is an important development, and it's something that we will want to emphasize in the interim health plan itself. The guiding principles I talked a bit about already, the 7 directives. The work on engagement pathways has been really clearly established. Operational guidelines and policies. Really, many of this will really just capture work that's been done to date. We are doing some work as well in terms of performance standards. And a part of what we would see also going forward is being able to do the work to also reflect the emphasis on wellness. So there is some work that does need to be done, and we'll be working with partners to develop performance standards that really reflect the interest in wellness, and then will enable us to report on and evaluate ourselves in terms of those wellness indicators. A section on governance and organizational structures and cooperation. Again, much of this work has been done already, but it will also be a way to document the mandate and vision and the relationships to other organizations, our participation on different committees, the accords that have been developed both internally and externally, and a description of how we will work with partners in terms of really executing the goal and mission that I described earlier. Next page, please. Again, you can see here the idea that we would reflect within the interim health plan the regional First Nations context, and at minimum, what we would expect is that there will be a reflection of the regional profiles and the priorities that have been established within each of the regions. And we also expect that we would have an overview of those regional health and wellness priorities provided. Now, each of the regions are in different spots in terms of completing health and wellness plans. For those that have completed those will be included in their complete form, but we would expect that and hope that at minimum that each of the regions would have a set of priorities and a set of interest documented for the first interim health plan. And similar to what I described for the strategic plans for First Nations Health Authority, for the Health Council and Health Directors Association, that this will serve as a bit of a placeholder so that over the next year we can really more fully develop these plans and include them in a more comprehensive way in our second version of the interim health plan. Environmental scan, basically this will just document where some of the work has already been done. For example, there are sub-agreements that have been done in a number of areas. Those are all in the midst of conclusion as we speak. Those include such items as the capital planning, what will happen with First Nations health benefits, business continuity, and other sub-agreements that really will be part of implementing the First Nations Health Authority. Many of those are in their final stages and have been approved in principle. So really we will include those within the health plan. At this stage as well, there is an evaluation of the health actions work and the programs that have been in place for the last few years. So there will be an evaluation which we would expect to include within the overall interim health plan. The expression of the partnership development and implementation, which really includes at minimum the partnership agreements that have been developed with each health authority, and in the case of Interior, they've actually done letters of agreement with each of the nations within the health authority as well. So those will be included within the plan as part of the documentation of achievements to date. The community engagement model and the approach that's been adopted will similarly be part of the documentation and is really part of looking at the achievement to date in terms of advancing in a very direct and concrete way the pathways for community engagement. And the other aspect will be the organizational development in terms of both where it's at, but also in terms of the transition of public servants over to the First Nations Health Authority, which is scheduled to occur on October 1st. In terms of service and program delivery, one of the items I would focus on here is that the regional offices are in process of being implemented, and part of what will happen over the next couple of months is there will be interviews done with key stakeholders at each regional level to design for each of the 5 regions what would be the job profile of those regional positions, and then we would anticipate that there would be individual competitions put into motion very quickly thereafter. So the regional offices implementation is a key part of what will make this First Nations Health Authority different and unique going forward, and it will be an important part of the development and evolution over the next weeks to come. And of course, a focus on transition and really managing the risk as we go forward. All of those aspects are part of the business planning piece, and I would expect that these will proceed again and be finalized within the next days. Next slide, please. So in terms of other sections, one of the things that will be important is the goals, milestones, and priorities. We'll document those. Again, much of this work has been done already, but we will link these to our go-forward set of interests, and these will be put together and documented over the next days. Looking at the challenges and opportunities, really recognizing that this is a historic process, but also then looking at as well how can this opportunity really be best positioned in terms of improving services, focusing on excellence, and looking at new ways of delivering services in a way that's consistent with the directives to be community-based and nation-focused. So our first interim health plan will really help us in that process and really position us in terms of the transition to come. So part of the interests are how do we as well use the processes that are put in place, which include the political processes, which are represented by the First Nations Health Council, the technical inputs and contributions of the First Nations Health Directors Association, and the operational arm and interests which are carried out by the First Nations Health Authority. And as I said, really making sure that the community regional element is a key part of that model and that delivery system. I would say in terms of one thing I just want to comment on a bit is in terms of challenges and opportunities are that we're seeing that many of our communities and service delivery groups are actually achieving additional services through the regional health authority competition processes, which are through provincial funding. My information to date is that there are 16 new nurse practitioner positions that have been created across the province, and these will lead to improved access to primary health care services. In the second round of competition, just hearing about where some of the First Nations groups have scored quite highly, I would guess that we would have another 5 to 6 nurse practitioner positions also approved shortly. And I would encourage that we strategize how to take advantage of the last call for the nurse practitioners for BC competition, which will unfold likely over the next year. So there have been gains and improvements in services in terms of working with the respective regional health authorities. And I would say this is really only the beginning of this process, that as well that there are opportunities to participate in the physicians' alternative pay plans and other physician-based opportunities over the next year. And I think this will be an exciting part of development, as well as seeing our First Nations communities have better access to family practitioners. So again, I think looking at the challenges and opportunities, I think that it's really clear that there is much to gain through the processes going forward. So in terms of our implementation consideration, well, I think we want to make sure that we're monitoring this, that we're really engaging with each of the regional groups, the regional caucus, and really supporting the work that's going in each regional health authority. So our goal is really to support that work and find ways of working with you. Next slide, please. I'll talk a bit more about evaluation and reporting, but there is an evaluation framework that's being developed, and this I would expect would be finalized within the month of April, and that's something that Dr. Wiley will be a key participant for on behalf of the First Nations Health Authority. We will, the funding part, we'll put our annual operating budget and the sources of funding. That'll be a pretty clear document, and this has already been approved and finalized by the First Nations Health Authority Board, so that's essentially complete. We would anticipate that we would attach a number of key documents to make sure that we've provided as much information as possible, and as I say, any community, any nation, and any regional group who has completed their process, we will attach those so that they can be an important part of this document and we can track them going forward. So that's essentially the framework, and as I said already, the evaluation framework, next slide please, will be completed in the month of April, and then we will report out on this framework and how essentially we'll measure this or put in place the measurement interests, which will then enable us to evaluate the program in year 5 As I mentioned earlier, I think it'll be important for us to really look at important wellness indicators. As I said, there's really no other regional health authority or provincial health authority that has wellness as a clearly adopted standard. So it'll be really interesting for us to develop the measures that we will then be able to report on and measure our progress. And I think that will be a set of exciting developments going forward. Next slide, please. So as I believe I've alluded to, it's a bit of an evolving process in that, especially for the first interim health plan, that we're actually only assuming control of the programs under the federal health programs in stages, and as well because the regional health and wellness plans and the community priorities underneath those are evolving at this point. One of the things that is being developed is a model for regional health plans. This is being led by Mark Matthews. Sorry, a little bit of a brain lock for a second there. Mark Matthews, who has developed this working with the Northern Regional Health Authority with Dr. Margot Greenwood. So it's there's some good models developing, and we would anticipate that this would be a good framework for those regional health and wellness plans going forward. The first interim health plan will be big picture, and that when we get to the multi-year health plan in year 3, that it will be more detailed and comprehensive. We also anticipate that we will build our planning cycle around the 18-month gathering wisdom cycles. As you know, the gathering wisdom meetings were usually on an annual basis. The decision has been made to take those into an 18-month cycle. So our planning cycle will be intended to coincide and take advantage of the opportunities of these very exciting and detailed meetings as part of our multi-year planning cycle. So, so that will unfold. Next slide, please. The other aspect is that there is not only the First Nations Health Authority operational and corporate service planning cycles, but we have our annual budget and Health Council and Health Directors planning, which is going forward. And what we would anticipate is that we will have strategic planning frameworks that would be consistent with each of our 3 organizations, that these will reflect community health plans and priorities, and further that we will have regional health and wellness planning and priorities, which will then enable us to match up with the plans of the regional health authorities. Those are characterized as Aboriginal health plans. And then as well, lining up with First Nations Inuit Health Branch strategic and operational planning cycle. In fact, for this year, we've actually had a joint planning process with First Nations Inuit Health Branch, where we've worked with the staff in the branch and made sure that their plans for this year are really reflective of the 7 directives and of the mission and vision for the First Nations Health Authority. So we actually have, will have within the next few days a plan which has been prepared in collaboration with First Nations Inuit Health Branch, and which documents those plans for the next year. So again, we're fairly well positioned in terms of being able to have that, which will really describe how the programs and services currently delivered by FNHA will be delivered over the next year. So I think I've covered the idea that we would make sure that the interim health plan considers and implements the relative agreements with partners. Next slide. And this slide really reflects how all of the pieces really will contribute to the interim health plan. So it's really a bit of a visual. So next slide. Similarly, one of the things that we want to make sure is a very clear part of the interim health plan is a real emphasis on how regional BC First Nations communities priorities fit into the regional health and wellness plans, which then fit into the interim health plan and the subsequent multi-year health plan, and that this is an important part of carrying out the 7 directives of community-driven, nation-based approaches. Next slide. So part of what we will do in terms of preparing the first interim health plan is that we will engage in dialogue, carry out the the engagement which was really outlined in developing the engagement pathway. We've already made presentations to the Health Authority Boards of Directors, to the First Nations Health Council, to the Directors Association, to the Implementation Committee. We're in the process of doing so at regional tables. And I would say part of today is to make sure that we are providing the information widely across the province through this webinar. We've made a presentation at First Nations Inuit Health Branch, as well as at the project board for the BC Ministry of Health, which really is the senior executive board overseeing relations between the province and the First Nations Health Authority. And of course, we'll do so with the regional health authorities. So we are engaged in these presentation and dialogues, and we would anticipate having a draft document for review the first week of May. So last slide, I'll just conclude by saying we would seek feedback through the month of May, and that we would submit a draft by June 1st. Again, I see that as a bit of an evolving document, but it should be something that's relatively complete and should be quite detailed. But again, I'll leave that for you to assess once you have access to it and around the first week of May. And then we will, of course, then have a cycle of engagement following that with using the engagement pathways and working with our partners. So with that, I've gone through in a fairly detailed way, perhaps hope not too much, but just what the interim health plan will contain. And at this point, myself and my colleagues, Isabel Budke, who will also be part of our drafting team and will be a lead in terms of assembling the documents, is here as well. But look forward to the dialogue and questions and comments in the next period of time. So with that, thank you.